My name is Blaine Marshall, and I'm doing an informational speech on chronic pain in the workplace. Approximately 100 million Americans currently suffer from chronic pain, with about 25 million of those not being able to work due to moderate to severe chronic pain. There's a huge societal cost that comes with chronic pain. Approximately every year, 560 to 630 billion dollars are lost because of missed work days or medical expenses. Both of those statistics are from the National Institutes of Health. And what I'm going to do today is define what chronic pain is, how to prevent it, and what to do if you're currently suffering from chronic pain, and how to apply that in the workplace. And the reason why I chose this topic was because I have experienced researching chronic pain in a health psychology lab. And I did research with older adults, and I also wrote a paper on the opioid epidemic. So what is chronic pain? Chronic pain is persistent or repetitive pain that occurs usually after a traumatic injury, and it can be ongoing for as little as a month to as long as years. There's different definitions of chronic pain that depends on your frequency, duration, intensity, things like that. It's a pretty subjective thing, and that definition is from the Journal of Pain. And chronic pain is more than just a physical condition. There's an emotional portion to it as well. The pain can cause a lot of negative emotions. People who suffer from chronic pain are more likely to develop depression and anxiety. 59% of lower back pain sufferers exhibit symptoms of psychiatric diagnosis, and that's from the Canadian Journal of Psychiatry. And even those negative emotions can exacerbate those feelings of pain as well. So preventing chronic pain in the workplace. So before it even starts, the best way is to stop it from starting. If you suffer an acute injury, a fall or something, or an injury in sports, you want to make sure you get it treated immediately, because if you don't, it's going to develop and just get progressively worse. Other than that, good exercise, good nutrition, weight management, getting enough sleep, and reducing stress, and that's all from the Work Wellness and Disability Prevention Institute. Another good one, especially in the workplace, is maintaining good posture throughout the day. Hunching over, looking at your phone, looking at your computer can lead to a lot of neck pain, back pain, fatigue. You want to make sure whatever you're looking at is at eye level. You don't want to be looking down too much. You kind of want everything to fit with the natural curvature of the spine. And that's from the Practical Pain Management Journal. And then using ergonomic devices throughout your time working. If you're sitting down a lot, making sure you have cushions that you're using for your back, for your wrists whenever you're typing and you're doing things with your mouse. Unfortunately, chronic pain may be inevitable because of some unforeseen injuries. We never know what's going to happen, and so even if you do get certain treatment, prevention might not always work for stopping chronic pain from happening. So one thing that we have to acknowledge is that chronic pain isn't something that's always curable. It's something that you're going to have to manage for the rest of your life if you do have it. So reframing your outlook on how chronic pain is, and reframing that it's something you have to manage for the rest of your life, can be very beneficial and change your outlook. An interdisciplinary treatment approach is vital for the proper management of chronic pain. So it utilizes psychologists, physicians, physical therapists, etc. Because there's a bunch of different aspects to chronic pain that need to be treated. And that's from the American Psychologist. One important thing, a psychological technique, is chronic behavioral therapy, or cognitive behavioral therapy, which utilizes different cognitive techniques to combat any negative thinking that can occur because of chronic pain. So that's using like stress management, problem solving, goal setting, and assertiveness that you can use in the workplace, especially if you're talking with your boss about like what you need. You're stressed out because of your pain, reframing, oh, I'm in pain because of, I'm sitting down too long, I need to get up, or anything, oh, it's just a pain, And then again, using ergonomic devices and exercises. And so this treatment can be really difficult to use, especially in the workplace, because it requires a lot of doctor's visits, a lot of different accommodations in terms of devices you need to use, places you need to be. So it's good to communicate with your boss, make sure you have a good relationship with them, and know that just because you have chronic pain, it doesn't mean it's going to hinder you. So chronic pain is an extremely complex and ever-growing problem that needs to be addressed. More and more workplaces will see the effects of chronic pain over time as we continue to be in a culture where we use a lot of technology, looking down at everything. So we need to learn how to properly accommodate those who suffer from chronic pain. And people who have it still can lead successful lives as long as their accommodations are met.